Hello again. My name is Dr. Ronald Popper, and I am a board-certified sleep medicine specialist and the medical director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. In our last video session, we talked about Restless Limb Syndrome. Today I'd like to talk to you about some of the treatments that are available for Restless Limb Syndrome. The primary treatment class of medications are known as dopamine agonists. This is a class of medication that is used primarily for the treatment of Parkinson's disease. When using these medications for the treatment of Restless Limb Syndrome, we use them at a much smaller dose than we would use for Parkinson's disease, and therefore the potential side effects are much less. The most common drugs within this class of medications include Mirapex or pramipexole and ropinirole or Requip. The most common side effects that occur when using these medications include headache or nausea, an increase in sleepiness or fatigue. Some patients feel drugged or have coordination difficulties upon arising the next morning. There's a black box warning that talks about a very uncommon side effect, which is sudden uncontrollable sleep attacks. This was almost never seen in patients with Restless Limb Syndrome and has primarily occurred in patients with Parkinson's disease who are taking vastly larger doses of this medication than patients with restless limbs will ever take. In addition, there's a small incidence of an increase in compulsive behaviors, compulsive gambling, compulsive shopping, compulsive lying, compulsive sexual activity. Any compulsive behavior can occur within this class of medications. When using these drugs, we are always striving to use the smallest effective dose. So we titrate or gradually increase the dose until we find that it's effective with the least amount of side effects, and preferably no side effects. The next class of medications that we use to treat restless limbs is a class of medications known as anticonvulsives or neuroleptics. And these drugs were initially used, as the name implies, in treating epilepsy. And just like with the dopamine agonists, if we compare it to the use of aspirin or Tylenol, which can treat both fever and pain, we have found that these medications are often useful in treating other disorders, in this case, restless limb syndrome. The drugs most commonly used in this class of medications include Neurontin or gabapentin, and Lyrica or pregabalin, and more recently a long-acting version of gabapentin known as Horizont. The third class of medications which we often utilize for the treatment of restless limb syndrome include a class of medications known as Benzodiazepines. The most commonly used within this group is a medication known as Klonopin or clonazepam. This medication is also very useful as a sleeping aid and as a treatment for anxiety. Patients with restless limbs often have insomnia and are anxious about their insomnia, and clonazepam can be used as a supplement in the treatment of this disorder. Another class of medication which can be useful are analgesics, in particular opioids or narcotic medications. Many patients and physicians as well are reluctant to use these medications in the treatment of restless limbs, but they can be very effective if the dopamine agonists or neuroleptics are either not tolerated or were found to be ineffective. Sometimes we have to use multiple medications to adequately treat restless limbs, including all classes that we've previously discussed. Some patients prefer to use over-the-counter medications. While these are not always proven to be beneficial, some patients will respond to simple measures such as the use of over-the-counter analgesics, such as Tylenol or Advil. Sometimes supplements such as calcium and magnesium are also helpful, and especially if we find that your blood iron levels are low, or in particular your ferritin level is low, the use of supplemental iron can be very effective in the treatment of restless limbs. I hope this brief overview on the treatment of restless limb syndrome has been helpful. For more information, please visit my website. And always remember, sleep well tonight for a better day tomorrow.